So how do you treat infertility? Let's talk about it. Infertility affects 15% of American couples. If you can't achieve pregnancy within 12 months of trying, you need a consult. And if you're over the age of 35, do not wait longer than 6 months before getting assessed. The diagnosis of infertility starts with asking 3 questions. First, is there an egg and a sperm? Measuring anti-Mullerian hormone reveals how much ovarian reserve a woman has, then checking her progesterone levels in mid-luteal phase to see if she's ovulating. Men need a semen analysis, which checks the number of sperms, spermatozoa mobility, and if the sperm is formed normally. Now, the second question we ask is, can the sperm and the egg meet? Is the cervical mucus adequate? Are the fallopian tubes blocked? Is the uterus lining adequate for implantation of the fertilized ovum to occur? Can the sperm exit the vas deferens? The third question is, can pregnancy be maintained? Is there enough progesterone and is your cervix competent? Cervical procedures like LEEP or cone biopsy can weaken the cervix, which may cause early miscarriage. It's your corpus luteum's job to make enough progesterone under the influence of embryonic HCG to maintain the pregnancy for the first 14 weeks. Then the fetal placenta takes over progesterone production. And most women who have infertility issues will need progesterone support through the first trimester of their pregnancy. If you're not ovulating, then it's time to get your hormones checked. Not just your sex hormones, but thyroid and prolactin. And if you have signs of PCOS, DHEA levels, and insulin resistance markers. Low thyroid and high prolactin must be treated to conceive. Hypogonadism in men who do not make enough testosterone can lead to low sperm count as well as poor sperm quality. Mechanical issues like blocked fallopian tubes, which prevent sperm from reaching the egg, or damaged vas deferens preventing sperm from leaving the testes must be corrected. Usually adhesions due to infection, radiation, or in the case of a woman, endometriosis are to blame. Surgery may be required. Now, I've seen women get diagnostic hysterosalpingogram and the dye sometimes clears their fallopian tubes. If there's an egg and a sperm and no blockages in either partner, then we investigate immune issues like high inflammatory markers. Anti-semen antibodies are very common in PCOS patients, as well as men with low sperm counts. Treatments may include sperm washing combined with intrauterine insemination, corticosteroids, and IVF. But can you treat infertility naturally? Yes. First, clean up your lifestyle of any toxic exposures. Avoid alcohol and illicit drugs. Even cannabis can suppress semen production. Men need to avoid high heat exposures like soaking in a hot tub. Eat a healthy, organic, plant-based diet and get enough sleep. And support your hypothalamus. Why? Your hypothalamus controls all your hormones and your immune system. By giving your hypothalamus nutraceuticals to optimize its function, your fertility can increase. Genesis Gold improves hypothalamic-pituitary, ovarian, or testicular feedback, improves receptor sites activity, helps lower inflammatory markers, and helps improve immune function, so there's less chance of autoimmune issues interfering with fertility. It may take a woman with PCOS 3 to 6 months of supporting their hypothalamus with Genesis Gold to conceive. In hypogonadal males, Genesis Gold helps improve receptor site activity, balance hormones, in addition to testosterone therapy. And a few infertile patients who have come to me with hyperprolactinemia start on Genesis Gold, and within a month or two, their prolactin levels have dropped low enough for them to conceive. Now, if you have any questions, please join me in our hormone support group. You can get access through my free hormone reboot training. I'll see you in my next video.